Based on your disease, your doctor may have recommended an allogeneic stem cell transplant. This means the stem cells are from a donor, either a family member or an unrelated donor that has been selected from a bone marrow registry. You will receive chemotherapy, radiation, or both for several days leading up to the stem cell infusion. This is called your conditioning regimen. There are many different conditioning regimens. Your age, disease, and overall health status will help determine which conditioning regimen your doctor recommends. You will stay in the hospital for several weeks for your conditioning regimen and recovery. Your length of stay in the hospital will depend on how soon your blood counts recover and when your doctor feels it's safe to dismiss you. When you're released from the hospital, you'll be required to stay in the Omaha area for about 100 days after your transplant. Social work will talk with you about available choices for lodging. You must have a care partner with you when you're outpatient. Your care partner will help with your medications, meals, and transportation to your appointments. The care partner role is discussed later in this video.
Allogeneic stem cell transplant compared to a surgical procedure is different in terms of expectations for how long I won't be well. The procedure involves a time where you're receiving chemotherapy and some radiation, followed by a graft that goes in, infused just like blood transfusion, followed by about 2 weeks of not feeling well. And then afterwards, the engraftment happens, and then you start to feel better. However, the feeling better part is also gradual and not sudden. The take-home message I want to say to the patient is that this is reversible in more than 9 out of 10 times. Improvement does happen. It can be variable in timeline, but it does happen. The first 3 months, in terms of quality of life, it may not be normal compared to pre-transplant, but also improvements in that department happens too. So I think going in transplant with somewhat adjusted expectations of this is winnable and this can turn around in a positive direction, and B, although this is winnable, it doesn't happen very quickly, just like a surgical procedure. It will help patients not get frustrated, if you may, about how come I'm not getting better soon.
In the year 2000, I was teaching first grade, and I had to have my gallbladder out. And while I was doing the workup for that surgery, they discovered my liver was enlarged and did some tests. And I was diagnosed with myelofibrosis. And I was told there was no treatment for the disease. There was no chemo, there were no pills, and the only chance for a cure would be a bone marrow transplant. My brother and 2 sisters were tested to see if they would be matches, and they match each other perfectly, and I don't match them. Once I came to Nebraska Medicine and met Dr. Gondabaloo, and he asked right away, would you consider transplant? And I told him, well, my siblings aren't going to be able to be my donor. He said, well, we can figure that out. And so I was told then that I had 3 possible perfect matches, and I was elated. I found out later that those 3 perfect matches were young people in Wasilla, Alaska, 2 sisters and a brother that matched me perfectly. My transplant was not until May of 2016. So in a few weeks, I will be celebrating my 52nd birthday. I am a Peer Connect volunteer with Be the Match, so a few times a month, I connect with people who are contemplating transplant or trying to decide if they should do it, and I tell them to listen to their doctors and to listen to their hearts and to pray about it and do what they can to make the experience successful.